Okay, I think I'll call the RAC meeting to order. Thank you all for being here. And I'll ask Jared if we have a quorum.
Madam Chair, I count 1, 2, 3, 5 RAC members either in person or online. So, or I'm sorry, 6. 1, 2, 3, 4, 5, 6. So yes, we do have a quorum.
Thank you so much. And we'll do introductions of the RAC, and maybe we'll start with online because I think we have one person online.
We do, Ms. Cordova.
Okay. Maria, you want to introduce yourself?
Yes, thank you, Madam Chair. This is, excuse me, Maria Cordova with the Independence Center. We serve Park, Teller, and El Paso counties.
Thank you so much. And then if we could go around the room, maybe if we can start over here.
Yes, Vincent Yannick with the Department of Human Services here with El Paso County.
Good morning, Bee Babbitt, Northern El Paso County.
Thank you.
Good morning, Gordon Rick, City of Fountain.
Good morning, Laura Cronick, Town of Monument.
Thank you.
Hello, Melody Hanna, Associate Director, Pikes Peak Area Agency on Aging. I just realized you were doing RAC members.
That's okay. I was going to do staff next, so go ahead.
Melissa Martz with Pikes Peak Area Agency on Aging.
Great. And if we could get an agenda approval, a motion to accept the agenda for today.
I so move.
Thank you, Laura. A second?
Second.
Thank you. Any discussion? Any problems with that? And we'll go on and then take a vote. All those in favor?
Aye.
Great. And then we'll go to the minutes. A motion to approve the minutes from the previous RAC meeting. Do I have a motion?
Madam Chairman, move to approve the minutes as written from Gordon Rick.
Thank you, Gordon. Do I have a second?
Second.
Thank you, Laura. And then anything that needs to be changed in those minutes at all? Okay, thank you. Can we just get a vote? Everybody in favor?
Aye.
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 Great. And we'll go on. We're now on number 4, public comments. And I'm going to ask Jared if we have anybody that's requested to make comments or any written comments.
So, Madam Chair, I'll ask anyone who is online or in the room who would like to provide public comment to either use the raise hand function within Microsoft Teams or to please go to the podium at this time. In the meantime, I'll let the RAC members know that we did not receive any advanced public comment and we did not receive any advanced written public comment that we would have submitted to the council members in advance. As I said all that, I see no hands raised. I do want to note, we do have one person in the room. So we do have one person in the room who'd like to provide public comment. Madam Chair, I just want to let the council know that we did have additional RAC member join since introductions. Rosemary Jaramillo did join.
Before the public comment, we'll let Rosemary introduce herself.
Hi, everybody. Rosemary Jaramillo from the Alzheimer's Association.
Thank you for being here.
Thank you.
And now we'll go on to public comment. Jason.
And I thought it was like an auction. I was waiting for somebody else to raise their hand first so that I got it there at the end. What I want to let everybody know is that on March 26th, Silver Key will be hosting a table captain meeting. And so what this is that we are intending to be able to broaden our donation support for those that are not familiar with Silver Key. So the filter is that if you know 5 people who do not really know Silver Key, they may recognize the buses, but not the deepness of what we do. I know all of you have awareness to Silver Key. I would love to have you or anybody that you know that cares deeply about older adult care and knows about Silver Key and has 5 people that have an interest maybe of learning but never have been introduced. That table captain meeting is March 26th from 3 to 5 at our Silver Key campus. And the actual program starts at 4. So we're going to give you food, a little wine, a soda, whatever you want to get you engaged. And then from that, we will tell you about the next event, which is our Silver Key Is event. That's going to be the way that we actually bring forward new dollars into the system to support the challenges that we're running into. So I would invite all of you and any of your partners that you know that might have an interest in being a table captain, March 26th, 3 to 5, our table captain introduction meeting. Thank you. Thank you for the time.
Thank you. Else? Public comments? Great. We will move on to number 6 on our agenda, which is information items, and we're going to start with presentations. And I see David from Next Day Access is. Oh, okay. So let's start with David, who's here. He can do his presentation.
Good morning, everybody. I'm David Biner from Next Day Access. Can everybody hear me? Very good. We have been AAA grant recipients, I think, since 17 or 18, quite a while. We still kind of do the same stuff. We are a home and bathroom safety and accessibility company. We help people in the community. We help people to stay in their homes longer and stay safer. We do a lot of things in the community. There we go. Technology. As a company, we do a lot of aluminum wheelchair ramps, modular systems. We do portable ramps. We do threshold ramps, which are that little bump at your front door that kind of everybody trips over. We can help people with that. We do stair lifts to help people get up and down the stairs. There's not a lot of ranchers around the El Paso area, so we do a lot of stair lifts. Porch lifts are kind of small elevators. We can do them inside. We do them in people's garages. Patient lifts, you might know them as Hoyer lifts. They're for people who are bedridden, who can't get out of bed or can't get out of their wheelchair. That's a patient lift. We do grab bars and grab bars and grab bars. We do bathroom modifications. We do pool lifts. Mostly in this area, we do actually hot tub or spa lifts. And we do portable showers. That's kind of a, if you can't get in and out of your shower and you can't afford to redo your bathroom, we have what's called a portable shower. You can set it up in your kitchen. It has walls and you can wheel into it and you hook it up to the sink and you can take a shower. Better than a sponge bath. Been at this location for about 5 or 6 years. Not sure. I think we just signed a new lease. It's a nice place. It's right off Garden of the Gods on Chestnut Street. Everybody knows where that Wells Fargo is. We're just down the street from there. There's our stair lift demo. We do sell scooters and power chairs. If anybody's looking for a really good deal on a scooter or mostly scooters, we are starting to go out of that segment. The online people are just too strong for us. And even if our prices are better, I'm not quite sure why people will come in and sit with one of our salespeople in the office and they spend more time looking at a scooter than they do buying a car. And then they go to the online place and buy it from there. So if anybody's looking for a great deal on a scooter or a little power chair, we're having a fire sale. We are an age-friendly certified business with a Better Business Bureau. From February last year to January, we haven't done our February. The numbers weren't there yesterday. We have served 120 clients in the El Paso County area. We do tend to limit ourselves just because of the drive time and the nature of the way AAA works. In terms of that, we're giving this stuff at cost. That we kind of limit ourselves to the El Paso County area in terms of delivering services. Once we start to drive hours and hours and hours, it becomes more of a loss than it is, a customer service or a feel good. Again, this past year, grab bars. We just do a lot of grab bars, and we'll talk about that a little later. Just simple, all mowing, all textured, not slippery. We do spend the extra money on grab bars. I call them a vanity ring. They have the cover that covers the screws. And I could probably save a little money buying the cheaper ones. They just look nicer. And they stay a little cleaner. We put a little bit of caulk around that ring. It stays nice and watertight, and it just looks prettier in people's homes. It's less industrial. We do exterior railings on the grant. We have a local welder who does things like this. So if we can't get a prefab one, we have a local guy who loves us, who does custom welding for these rails. We do interior banisters. One of the ones we do this is called a promenade rail. That's actually, sorry. Much better. That's actually an aluminum rail that has a wood veneer on it. We've gone to that kind of rail just as a time saving, because for us to go out and measure and stain and sand and stain and sand and gloss and sand, and it's easier to go to this prefabricated aluminum rail, and they don't move once they're in. They never require any maintenance. So they're pretty nice. That's another promenade rail. They all have returns on them. Those two ends that curve back to the wall are called a return. We have to have those on. Basically, if we left it sitting out, and I always tell people, if a lady's going up the stairs and they have their purse with them, they get hooked in the railing. And that's an easy way to fall down a flight of stairs, because you get 2 feet up and your purse pulls you back down the stairs. So by code, we actually, when we put in a railing, we have to have a return on it on an interior railing. We do modular steps. So sometimes you'll go into a house like this and they have one giant step going up into the house, and people can't deal with that. So we can put in a modular aluminum system. We talked about threshold ramps. That is rubber threshold ramp. So what's nice about these is they're made out of recycled tires, so they're kind of lean. But you can, on that left side where that logo is, you can come onto this ramp at an angle. And it's beveled all the way around. So if you have your walker or your wheelchair, you can come at this ramp from a 45-degree angle and it still works. I haven't presented to you folks in a while. In 2023, Jody and I got together. We had a really good idea, and you folks helped us purchase several AEDs. We wanted to have a first aid course for all of our staff members. And in the course of the first aid course, they did AED training with us. And I said, we should really have these on all of our vehicles. So all of our vehicles, as well as our showroom, my car outside has one too, for when I'm doing evaluations. Everybody has a defibrillator. And fortunately, we have never used it. So I'll take that as a positive. And all of our staff members are CPR and AED certified. So thank you, AAA. Some of the other things we've kind of found, we were always kind of looking for other ways to help people with this grant. And what we found is that we can kind of give some assistance, and it's not a lot of assistance, but it's some assistance with things like modular ramps. And we have tons and tons of this stuff in our house. But what we do is, and it's really on a case by case basis. And if we're out doing a sale and we give them a quote for their modular ramp and they go, I can't afford that. And nothing is getting any cheaper nowadays. So generally we'll give them a ramp is a couple of $1,000. And we can say, well, we can help you with $500 on the ramp. And every little bit helps, particularly with our demographic of clients. A lot of people are on fixed incomes. They need a ramp, and we can give them $500 off a couple of $1,000 ramp. We also do the same thing with stair lifts. Stair lifts are a couple of $1,000. They're right now running, the cheapest stair lift we have is about $3,300. When I started out 10 years ago, we've been in business for 10 years ago, our stair lifts were $1,900. That was our bare bones. They keep on going up, and everybody gets a raise every year, and so on and so forth. So we're right now, I think our cheapest stair lift is about $3,200. So we can offer some assistance with that, and people are very grateful for that little bit of assistance we offer. And not so much with these. That's a curved stair lift. We do those. Those are custom made for the set of stairs. You can see the black rail running down the stairs and turning down the corner. They're pretty cool. Just wanted to throw that in there. We still get a lot of referrals from local home health agencies. We'll talk about that in a minute, but that's still a lot of our referrals. And we are known throughout the community. We are trustworthy. And I think a lot of this is not necessarily what happens with the AAA funding is there's really not an income parameter to getting services through the grant. I have always said that because we're vetted through AAA, we're a trusted source to come in. We're not going to steal stuff out of your house. The guy's not going to be taking the last swig off his pint before he walks in the door. So I think over all the years that we have been AAA grant recipients, that trust has grown. And a lot of our referrals are from other people who have received our services. So there's a lot of word of mouth that goes on there. Betty next door got some grab bars from you, and I want some grab bars too. So I think that kind of speaks about how our reputation works within the community. You always ask about challenges. We got known as, and we're still trying to unbrand that, we got known as the free grab bar guys. So we are trying to, again, through helping people with assistance on some other larger ticket items, we're trying to get out of that reputation. But we still do we're still the free grab bar guys. And that's us. Questions?
I have a question. How do you determine which individuals, you said income is not an issue. How do you determine which people you serve through our grant rather than just them paying fully?
Being that a lot of what we do still are grab bars, railings, exterior and interior and exterior railings and grab bars, people call up and they ask. So generally people will call our office and they say, I need a railing on my front door. And we start to talk to them about the evaluation process. So we don't come out and say, oh, we got a deal for you. They have to actually ask us about the grant. And once they say, no, Betty next door got the railing, I want the free railing. And that's generally where we go with that. with some assistance with the larger ticket items, that's always based on, if I'm sitting in the house or everybody here knows Phil Stafford. Phil Stafford works for me. He really kind of judges it on a case by case basis. There are some people who go, "Oh, that's nice, I'll take it," or "No, get out of my house," or "Gee, that's a lot of money. I don't know if I can afford that." That's when he'll say, "Hey, we have this program where we can help you out a little bit." So that's kind of how we do.
Great, thank you.
I have a question. Dave, how far north do you go?
We go up to Castle Rock.
Okay.
So we absolutely work in Monument. I know for years people kept on asking me, "Why don't you go to Bailey?" Bailey is not in our service area, especially on the that we do this at cost. It's not economically feasible for us to go that far northwest. But we cover all of El Paso County. I am a franchise. So my franchise territory is Pueblo, Teller, El Paso, and Douglas counties.
Thank you. And what are some of the accommodations that people don't realize they need till you get there and sort of point it out?
One of the things is people say, "I need a grab bar." And we say, well, actually, we always suggest, especially in a wet area in a shower, that it's actually preferential to have at least two. There's usually one that's right at the entrance to the shower and one that's actually in the shower. So that's kind of an educational process. And, when my technicians are there, they'll kind of observe and say, "Hey, looks like you're having some problems going up the stairs. Would you like a railing? We could put in a stair lift for you." All the technicians carry kind of sales material. We call it a blue folder. And it talks about things you can do through the VA, things you can do through Medicaid, through TRE, as well as product flyers. So part of our blue folder is directing them to other resources that can help them pay for their home modifications. So that's kind of some of the things that they don't realize, that there are other sources out there.
Sure. Thank you.
And at this point, you are still getting reimbursed through Medicaid? I mean, I think that's probably may change.
Yeah, I mean, we could be the largest Medicaid home modification provider in the county. We're a big player in that field. I don't know if we're the biggest, but if we're not the biggest, they're not beating us by a whole lot. And so far, I mean, that's through the state. So that goes up to, that's DOLA, the Department of Local Affairs, and DOH, the Department of Housing. And our Medicaid program is pretty robust. I mean, I have a lady who does almost 90% of what she does is Medicaid processing. So I have my fingers crossed that that home modification program is not going to change.
So if there are cuts, the state would then notify you that, these things aren't being funded any longer, or?
I hope so. I would hate to do work and then have them say, "We don't have money for you." That would make my subcontractors extremely angry at me. So I don't, that's, most of that is federal money. It's administered at a state level. And then it's federal money that's administered at a state level, and then it's administered at a local level through a single entry point like TRE.
What's TRE?
The Resource Exchange.
Okay.
And so a single entry point means that any type of assistance you need, whether it's food stamps or WIC or a home modification, or anything that's related to Medicaid, is all under one roof. That's a single entry point, and TRE is a SEP. So I know how to play the game.
Great.
Okay.
Great.
And I'm hoping, I kind of saw that on the news, and I guess it depends what news you're watching, as to how this money is going to be allocated or reallocated or cut off, or
I don't think we know yet.
I don't think we know yet either. I found it very interesting. A very good friend of the family, was my father's clergyman, runs a women's shelter, or uh, they run a women's shelter in Africa. And, you know, we sit and we watch, USAID, and we hear one side of it, that they're doing all these terrible things. And I got an email from him this morning going, well, I know that they said that, but here are all the other things that they do, that help all these battered women in the shelter. He goes, our shelter doesn't get any money from them, but there are these other programs that are indirectly related to either the aid workers or the people who are in the shelter, and that is now going away.
Yeah, I think all those religious organizations aren't necessarily impacted at this point in time.
Correct. And this is a secular shelter. This has nothing to do with religion at all. They opened it up because their daughter was involved with that, with those people in Africa, and she was tragically killed. So the father and the mother took up that cause and opened up this shelter. So there's not a religious aspect to it at all. None of them are Jewish. So they just run the shelter in honor of their daughter. But he said, you know, I know what you see in the United States, but these are the good programs that ran through this. So we'll see what happens. Any other questions?
David, I just want to say thank you to you and your team for being wonderful to work with. And you're the only partner we have that does this kind of work. And it's great to have you as a partner. So thank you.
Awesome. Thank you. You done with me, kicking me to the curb?
Yep.
Okay. Thanks.
And our next presentation is Brother Redevelopment. And I understand that Catherine is online and will do that presentation.
Yes, can you hear me okay?
Yep.
Okay, and I apologize in advance. I am halfway through a terrible cold, which is why I'm not presenting in person. So bear with me. I'm going to share my screen here. Let's see. Okay. Can you see it okay?
Yep.
Okay, great. Okay, so my name is Kathy McMichael. I am the Senior Administrator for the Home Modification and Repair Program with Brothers Redevelopment. We are a nonprofit organization that has been active since 1971. We did begin in the Denver metro area. The program, the agency was founded by a group of ministers who did volunteer minor home repairs for a few years. And then over time, as the program got more popular, they were able to not only add to the volunteers, but they took on some grant funding. And we now cover multiple grants for HICPA, for HUD in the form of Community Development Block Grant funding. We work for multiple area agencies on aging. Dr. Cog is our largest one, and we do a lot of work for the program. But before I even jump into the home repair and capable programs, I just want to give you a quick overview of what else we have to offer. We do have a paint-a-thon program. That is a volunteer-run program where they gather volunteers from organizations, banks, nonprofits, schools, and they will paint a client's home. A lot of times the funding is covered by the CDBG funding through multiple cities and counties. For example, Colorado Springs does cover the paint-a-thon program. for the city. It's been very, very popular. I think they're entering their 48th year this year. So they're right behind us as far as age of program. We have what's called CHC, that's Colorado Housing Connects. So that's a statewide call center where people can call in regarding anything related to housing. So if they need help with mortgage and rent assistance, if they need a place to live, they do landlord-tenant mediation. We offer first-time homebuyer classes. There's just a lot connected with that program. That is also connected with our housing counseling program as well. So they work closely together under the same umbrella. We have an aging in place program that primarily covers the Denver metro area, but they do get calls from all over the state. They do have case managers in Denver that will meet a client, do home visits, do a full assessment to determine what kind of benefits they may qualify for, like long-term care, Medicaid, SNAP, even finding a new place to live, like an assisted living, help them get on pace, anything they need that will help them either stay in their home independently, or, if they need higher level of care. We get a lot of referrals from that program for our home repairs. We have a housing placement program. So we work with people coming out of nursing homes to help them find safe housing. We actually just signed a contract with HICPUF and DOLA to do accommodations. Sorry, just lost my what it's called. It's a brand new program. So we'll be putting in accommodations into either apartments or houses to help people transition and stay safe in their home. So right now, we have signed up to cover 3 regions in Colorado. So that's really just Denver, Southern Colorado. But by August, we'll be covering the entire state with that program. And that is by using vetted subcontractors that are signed up through the federal government, sam.gov. So that's going to be a huge program for us. Again, we offer rental, utility, mortgage assistance. Lots going on. We also have a property management program. It's under the umbrella of Brothers Redevelopment, but they run as their own entity. So we build, manage, and oversee, I think we're at 17 apartment complexes in the Denver metro area. They range from senior housing to, we have a brain injury complex on Colfax. And right now we are currently building a complex in Aurora for people coming out of prison. So we also right now, as far as Colorado Springs goes, we do manage the Greenway Flats apartment complex. I think we've been running that for a couple of years now. So I just wanted to share kind of a snapshot of what we did last year. We have a lot going on and we just continue to grow in every direction. So we assisted almost 42,000 individuals with a cost savings to older and disabled adults of $3.4 million. Almost $12 million in rent, mortgage, and utility assistance. 346 homes that we helped to rehab or modify. and then an additional 113 homes that were painted up and down the Front Range. So we've got a lot going on. And I expect these numbers to be even larger next year with the new programs that we've just added. So this is, I don't know if you can see it very well. It's kind of crunched up, but these are a list of our programs. We just picked up Erie and Longmont, Colorado, their CDBG programs for home repair. So let me explain a little bit more now that we're kind of diving into this area. So we are able to help with a variety of things for homeowners. We help with emergency repairs, so that would be plumbing, electrical, sewer line. We do water heaters. Sometimes we'll do furnaces. A lot of times we will refer people over to Energy Resource Center. They are one of our partners. But we can do larger projects as well. We can do roof repairs and replacements, bathroom modifications. We install ramps, stair lifts. We can widen doorways. So a lot of accessibility work. The main focus is safety and accessibility, keeping people in their home as long as they can. We do work with renters in Colorado Springs through their program, just for accessibility needs. We are a licensed Medicaid provider in the Denver metro area. Here's that program. So PICPUF, it's environmental adaptations. That's our brand new program that we're just about ready to ramp up. But yeah, we are just kind of all over the place right now. We're hoping eventually to move down into the Pueblo area. There's a huge need. I get phone calls every week for that program. And they have their own CDBG program, but I think it's on hold. I think it's just a funding issue. So yeah, these are just examples of the kinds of things that we can help with. HVAC, plumbing, flooring. We can't replace carpeting, but we can take carpeting out if it's a trip and fall hazard. So we can put in different kind of flooring, tile, or like a wooden like flooring, just for safety. We are now required by HUD to do radon testing and mitigation. That took effect in July of 2024. So that has been pretty eye-opening, quite the undertaking. We have found several homes that are that have high radon levels up and down the Front Range. So that's been a big focus for us this past year. So Capable is another program that we've been running for a few years, and the Pikes Peak Area Agency on Aging is helping to fund this program. It's a little bit unique in the way that it's run. So it stands for Community Aging in Place, Advancing Better Living for Elders. This is a program that was started by Johns Hopkins School of Nursing in 2009. It's now being run in over 35 cities across the country. We ran a program for HICPUF Medicaid for 2 years that ended in August of 2024. I think we were able to enroll 80 people into that program. So I am very involved with that program. I do the outreach, just finding clients for, and I do the screening for the program as well. It's a half-hour screening. We're looking for people that have difficulties with their activities of daily living. So at least one ADL. So that's your basic bathing, walking, toileting, the basics, or you have to have difficulty with at least 2 instrumental activities of daily living. So that's going to be your cooking and cleaning, medication management. You don't have to have Medicaid for this particular program. We have a program funded by Capable, and we also have one we have 3 actually, Colorado Springs Health Foundation here locally, and then Key Bank has given us a 3-year contract for the Denver metro area. So we cover, I think it's 7 or 8 counties, the same counties that Dr. Cobb covers up there. We can help folks out with that program. And I do the screening for all 3 of the programs and recruiting. So send people my way for sure. With this Capable program, we have the ability to choose whether we work with people over 60 or 18 and over. And we chose to work to help people 18 and over. And I was just looking at our statistics here. I think we had, through our HICPUF program, 33% of our enrollees were over the age of 60, but the rest were under. And I actually enrolled 3 people with developmental disabilities into the program. The youngest was 22 years old, and they've all really benefited from it. So during the screening process, the first thing I do is a cognitive screening, because we're looking for people that have the cognitive ability to come up with 3 goals while on the program. And this is all centered around improving your ability to do your daily activities. And so they have to come up with 3 goals. They have to remember the goals. And this is over a 5-month period. And during that period, they're going to be matched with an occupational therapist, a nurse, and a handyman. And the nurse will make about 5, the OT will make 5 visits, the nurse typically 4, and then typically 1 to 2 visits with a handyman. So the program, it does run 5 months on average. However, you have to take into consideration, hospitalizations, illnesses. We've had a few clients that had to have surgeries, or they just go on vacation. We have a lady that went to visit family during Christmas, so she was gone for a whole month. And so that has kind of delays, as far as the billing process and reimbursement process. We are on track to bill for 3 people for the month of February. And we have chosen to help 10 individuals through the AAA funding. We have met that goal, and we are well underway with assisting them all. They're in different areas of completion, graduation. So during the screening process, I'm going to go through various ADLs and IDLs. I'm going to ask what their level of difficulty is. I do a fall risk just to see what their confidence level is in doing various ADLs and IDLs. And then we also do a depression screening. We just want to get a snapshot of where the client is before they start the program, so that we can do a comparison. We always do another screening and survey once a client graduates, just so that we can capture that data of where people have improved in what areas. And we've seen quite a bit of good data coming our way Um, and more to come for sure. So the major objectives of this program is to implement it into multiple counties, areas without compromising quality of service. So that's just ramping up our OTs, nurses. In Denver, we have through our home repair program, we have paid employees that work out in the field. They do a lot of our repairs and modifications. We also work with subcontractors up there, but down in Colorado Springs, we are strictly subcontractor. So we rely on them to do all of our work, including the handyman repairs through Capable. So through Capable, it's not a huge budget per client, but we are able to help with things like grab bars, handrails. We can put in an ADA toilet. We can, they'll do a full assessment of the home, and based on the goals that the clients have, they will put in modifications, accommodations, just depending on what they're looking for. The great thing about this program is you can think outside of the box. So we also focus on a client's hobbies, because we want to make sure that people stay active, not only, in the home, but, they're thriving in the home. They're doing things that they enjoy. So this is one of our Colorado Springs clients. She's a big gardener, has arthritis in her back. We actually built her 3 of these raised garden beds, which she absolutely loves. We have done that for several clients since. But we can also do things, we've modified a sewing machine so that, the client could sit more comfortably. We lowered the table, we extended the foot pedal. Our OTs and nurses get really creative. It's actually pretty impressive what they come up with. We can also do something as simple as a cane, a new pair of shoes, a walker, whatever they need. This is one of our clients. We got her a lift recliner because she was having difficulty getting out of her chair, and that just made her year. So it's a fun program. We've seen a lot of success with it. People, I think, feel empowered to make, these health decisions on their own. I think it kind of gives them a little bit of motivation, especially people that may be isolated, live by themselves, a lot of loneliness, and, just not getting a lot of support. The other thing that we do, in combination is, if they qualify for our home repair program, we will certainly help with, larger, more expensive repairs or modifications. But we also make referrals, to the area agency on aging. I've made a few for their home care program, case, Silver Key, whatever their need is. TRE to get the resource exchange to get the long-term care Medicaid process going. So we just kind of give a lot of support along the way with the help of our various programs. So that's really it in a nutshell. Let's see, let me see if I can, oh, here it is. Okay. Does anybody have any questions?
Yes, you have just one single number that individuals call for all these different services. How do you get them to the right service.
Yeah. So for Colorado Springs, that would be my main number. And I'm sorry, I should have put that on. What I can do if you want, I can send you the PowerPoint and I'll just, I have my email address on there, but I'll add my phone number as well. And my information will be in the signature with the email. But yeah, we do have one phone number here for the Colorado Springs office. That's a direct number for me. I'm pretty much it. I mean,
Okay.
there's a couple of other people that live in the Springs, but you know, they're in different programs. Everybody primarily lives and works in Denver. And I
So
mean,
you-
we got a few people, Grand Junction, Alamosa. We're kind of all over.
So you would screen people for and try to address their particular problems. Is that correct?
Yes. Yep. So I could see if they would be, you know, not only a good fit for our home repair program, but if they also would benefit from Capable, we get them on that program and any other agencies that may be able to assist them.
Thank you.
Thank you. Maria?
I have,
Yes.
go ahead,
This is,
Maria.
oh, I'm sorry. This is Maria. I was just, hi, Kathy. I was wondering if you
Hi.
have, how are you? I was wondering if you have any flyers that we could help get the word out to let people know that your program exists.
Yes. Yep, I sure do. We do have some newer ones. We took Hip Hop off. There are some at the AAA. I gave some to Melanie, but I can certainly swing by your office and bring you some for sure.
Great, thank you. Yeah,
You're
thank you so
welcome.
much.
Yeah.
I have a question. I'm just really impressed with all the, even if they're small, all the different kinds of services that you have. I understand you are a new provider, I think, for us in terms of our area agency. Where are you getting most of your referrals from at this point?
We get a lot of referrals from 211 and ERC. Those are probably the two biggest ones that we see. But they come from all over. A lot of people find us online. They get referrals from, you know, Silver Key, AAA, the Resource Exchange. That's really picked up a lot. They've really latched onto our Capable program. So we're getting more and more for sure. And just to clarify, our HUD run programs are much larger, so we can help clients with repairs and modifications up to $20,000 in Colorado Springs. We also have a program with El Paso County, but unfortunately, they just don't have, you know, the funding that the Springs does. They give us as much as they can every year, but we just have a long wait list. We just can't take on any new people. However, we have our Colorado Springs Health Foundation grant, and that's where we are picking up the slack for folks in the county and the city, just depending on what they need. There's no cap through that program. It just depends on what their needs are.
Great, thank you. Anybody else have any other questions?
So this is Melissa with the Pikes Peak Area Agency on Aging. Thank you so much, Catherine, for
Thank
all
you.
the great work that Brothers does around the whole state. It is incredibly necessary on in so many ways. I have kind of two questions for you. The first question, you mentioned that you guys are working with or have kind of in the wings 10 folks to go through the Capable program with the AAA funding.
Correct.
Just wanted to confirm that. And is that enough, or do you need more for the AAA funding?
More folks or more funding?
I'm unfortunately referring to just more people.
Yeah,
Because I know
right.
at one point in time
I'm
when
just
you had
kidding.
talked with us, yeah, you were not getting the referrals coming through. So I was glad to hear 10 people, but just wanting to double check that that is enough and you're kind of you're where you need to be.
Yeah, that's kind of our sweet spot so that we can give them, we've got a certain limit that we have in place for all the capable programs. And that kind of hits it. So
Okay.
we can give what we need without kind of spreading it out and maybe foregoing something that somebody may need. And as you know, we have yet to reimburse, and that's because of the process. But they're kind of trickling in now. We've got 3 for sure that we're working on billing right now. And that will be submitted in March for February, and then they should just start coming in after that.
Great.
Yeah.
And then I've always kind of been curious about Medicaid, the fact that the Capable program is serving people who are Medicaid eligible. With this particular, batch of funding that you have on multiple levels, but seeing that, you had a woman who was able to get a garden built. Did Capable funding pay for that? And is that kind
Yes.
of maybe the difference between, because a lot of times people who qualify for Medicaid can have many of the services that Capable is providing, but yet it's
Mhm.
also maybe not quite as robust. But maybe comment a little bit about, folks that would benefit just from having Medicaid coming in and, doing some home modifications, Medicaid's paying for it, versus kind of the Capable program and how the Capable program is really a kind of a step above.
Sure, yeah. So the long-term care Medicaid program, they mainly focus on the larger ticket work, like the bathroom modifications that sometimes cost up to $17,000. They do the ramps, they do the barrier removal, which would be the, widening doorways. So they do focus on those more expensive repair modifications. It's capped at $14,000. And so what we're seeing now with the resource exchange is they are using, the 14,000 on the major modifications. Then they're referring them to Capable to do the, grab bars, handrails, just the minor things, or just to give that client a little bit more assistance with something else that nothing else covers, like the lift recliner. I don't think that's covered by Medicare, Medicaid, but that is a really nice benefit that we can give our clients on the program.
Okay, thanks a lot, Catherine. I appreciate it.
Sure.
Any other questions? Great. Thank you, Catherine, and thank you, David, for your presentations. It was really helpful to find out a little bit more of all those different kinds of services that we're providing this year, because I think, this is although you're not new within the state, you're new within our area agency. So I think that's great to know about that. If we could go on, and I'm not sure whether we have any updates, but maybe we could start with our membership subcommittee chair. Oh, Maria, do you have any updates for us?
I
Madam
don't
Chair.
at this time, Madam Chair. I was going to defer to Melissa. Thank you.
Yep. Hey, hi, Maria. So we do have 2 people on the call today from Park County who are listening in and are considering applying for membership here with the RAC, possibly even being appointed by the Park County commissioners up there as well. And so I just wanted to take a minute and kind of identify those folks that are from Park County on the line today. First, I want to acknowledge Penny, who's the executive director with Park County Senior Coalition. She's on the line. But then we have Sheila Williams and Susie Walton. And thank you ladies for joining us today. And Maria and I will kind of follow up with them and kind of see what next steps might happen with those two ladies up in Park County. They've all worked closely with the Park County Senior Coalition, with Bill Bowles, and Sheila is actually on the Citizens Advisory Council with the PPACG right now. Her term is off. She's off of that committee in May. And so there's just a couple of different options there with those two ladies. So I'm glad they could join us today. And again, Maria and I will be checking back in with them and following up.
And maybe I could ask those folks who are online if they have any other specific questions that they'd like to ask us.
And Madam Chair, I'll just note for those three individuals, they have now been able to unmute themselves. It looks like Susie does have a hand raised as well.
Go ahead, Susie.
Very good, thank you. Yes, I was curious, how long the terms are and how often you meet.
So thanks for that question, Susie. Terms run 3 years. And the Regional Advisory Council does meet once a month officially here today, usually for about 2 hours. Sometimes the RAC is done sooner than that, but we're up to 11 o'clock right now. We've already been here an hour. We have a few more things to do. So that is that group. And then we do have a couple of subcommittees that are somewhat ad hoc. You'll hear today from the Strategic Review Subcommittee talking about work that they do. They meet quarterly for about an hour. Our Technical Review Subcommittee, which is the group that determines the funding that is kind of administered every 2 years. And so that group definitely is super busy during our contract renewal years, but then other times it's kind of a little bit more ad hoc. And then we have a membership committee, which really is just Maria. So we don't have anybody else on that committee at this point in time, but we have had more people on the membership committee in the past. And I think that is it. Those are our main committees, correct? I didn't miss one, did I?
No, that's correct.
Okay.
And I do want to mention that there are people that just attend our meetings online that don't necessarily come in for our once a month meetings, but they participate online. And I assume we're going to continue to have these hybrid type meetings. Any other questions?
Thank you, that's very helpful. If you have an application form, I'd like to get one.
I'll be happy to forward that your way, Susie. Thanks.
Thank you.
Okay, great. Maybe we can move on under information items to see the Strategic Review Committee, and Laura, our chair, is here, and they did have a meeting recently, and maybe you can summarize a little bit about that meeting.
Happy to, Madam Chair. Thank you. Yes, we did meet and we met. Magic, it just appears. We went through all of the elements and tried to update it into 2025. And we did this with the overarching feeling that perhaps there won't be the funds to do everything that we would like to be able to do. So we were trying to hone in on those things that appear to be the most critical. And you see here, transportation was one of those things. And we had some discussion about what's done today, what needs to be done tomorrow, or what we believe needs to be done tomorrow, and how we can affect any kind of pivot points to help these things get done. Transportation was one, and I believe the other one, we focused on two, and it was transportation and meals. So those were the two areas that we gave a lot of attention to, and we will be coming together again to put some more specificity around this particular um, spreadsheet.
And I just want to add, Laura, for those that are observing this meeting, that this has to do with our four-year plan,
Right.
which will be coming up in 2026. The Older Americans Act requires that and the state requires that we come up with a four-year plan. And what you're seeing is, those areas that we come up with that are significant in our four-year plan. And then this strategic review committee reviews that and sees where we're moving on the areas that we've decided on.
And in addition, thank you for leading into that. We discussed starting to look at the 2026 date, because as we all know, things come up very quickly. So that'll be in addition to what we go through on a regular basis here too.
Yeah, we make a lot of community area visits to get input from the local community on the various service delivery areas that those people who live in those communities feel are really, really necessary.
Melissa, do you have anything to add?
I'll just ask Jared if you can kind of scroll through the rest of this. Just kind of a reminder, there's the meals where Laura brought that up, just talking about the impact of possibly increasing food costs. Jody and I have a meeting on Friday talking about digital access with the state folks that are working on that. And then this was interesting. This just came up. You'll see the PBS Allies for Aging. This just came up super recently. So the PBS station, Rocky Mountain PBS, is launching a program where they're going to be featuring resources and services and supports and storytelling about folks aging. So that's a work in progress that's coming up. And they did reach out to us regarding that, just kind of some preliminary conversations around that programming that they're working on. And I think that might be it. Yeah, that's it. Okay.
Great, thank you. And if we have any other questions, we'll move on to D, which is our TRS subcommittee, and Gordon is our chair.
No activity as of yet, Madam Chairman. Staff is still trying to get a handle on funding right now. So before we can
Maybe Melody, you could just make some comments as to where we stand with those issues right now.
Yeah, I certainly can, and actually can move into the director's report on behalf of Jody, who is out today and asked me to share a couple of items. So I'll follow up on TRS. So what we learned about 2 weeks ago from the state was that we can expect to receive 75% of our current funding starting July 1st. And that is because the state is able to contractually draw down from our federal sources 75% of the funding. So we shared this with our providers so that they can expect that and work on their budgets and make cuts where they need to in terms of their programming. And our hope is that we will receive 100% of our flat funding currently, and that we can true up the contracts with our providers after July 1. So the purpose for this is so that we can continue to move through the approval process for our budgets so that we can execute on July 1 for our second year of the current contract, and so that we don't have to wait and then get contracts executed past July 1, and then there's a delay in getting funding to our providers. So there's process reasons for that. And if anyone has particular questions on it, not an ideal situation, but we're glad to have received some communication from the state, who they're waiting on communication from our federal partners, the Administration for Community Living. So I'm glad, and Jody is too, that we at least have a plan for the next couple of months in terms of how we're going to start the new state fiscal year. Any questions on that?
think
Okay.
that's good news.
Yes, and as a reminder, we are in 2-year contracts, and so July 1st, we're coming up on the second year of our budgets. So we do not have a request for proposal process. We only ask that providers submit a budget, so hopefully it won't be so administratively heavy as answering narrative questions and everything that is involved in the proposal. So later this year, we will be starting the new RFP process for our next 2-year cycle.
Do we know anything more about those funds that didn't get spent in that
The
would-
carryover?
Yeah,
Yes, so that is thank you for that reminder, a TRS update. Jody has been working with providers to determine who can spend down the carryover funds. And then also this is the time of year when we look at spend down for all of our providers to see if there's funds that we can shift. So the carryover funds are based on our federal funding parts. So there is some flexibility with some of the funding that falls under Part B, which is supportive services. But then with other funding parts, there isn't flexibility. For example, Part C, which is just meals. So some of them can only be designated to certain providers. Some can go to a variety of providers, and it's really based on what do our providers need and how can we distribute this equitably. So I know that Jody plans to have another meeting with our TRS.
okay,
Yeah,
great.
to talk about those amounts and the requests that we've received from providers.
And I know he wanted to do that because they only have until, I
June
think,
30th, that's correct.
till the end
So,
of June.
yes, so
spend
for
that
those carryover
additional
funds,
money.
yes, those were funds that were not spent in the last state fiscal year. And so receiving them now, we have until June 30th to get those spent down.
Great, thank you. Anything else?
Yes, so I
No.
have a couple of other updates. So we're in the process of our annual performance measure survey that I've touched on a couple of times. So we're getting those mailed out on behalf of our providers. And the goal is to have all submissions back for, or not all, but all of our entries submitted by May 15th. Would love to get all of the surveys back. Our goal is a 10% response rate. We're usually a little bit higher than that. So I'll have an update for that probably in our June meeting when we receive the responses and can share that out with the RAC and then also with the providers so they can see the survey responses as well. Jody also wants people to be aware that he has the Legislative Caucus on Aging on March 11th. He would really love for any RAC members to join. So anyone that wants to join for that, to observe, ask questions, see what that experience is like, and also help with advocacy efforts, he really encourage you, please reach out if you would like to join him to drive up to Denver. It's going to be March 11th they'll be leaving at pretty early. It starts at 7:30 a.m. So yeah, but he will be driving if that helps. So there's also a Zoom link that he plans to send out. So if you're not able to travel in person, encourage you to join by Zoom to learn what that's all about. Apparently it's a pretty great experience. Other legislative activities, the end of March, Jody has mentioned that he is a U.S. Aging board member. And so part of being a board member, they're able to fund his travel to the U.S. Aging policy briefing that happens in Washington, D.C. And that is a great experience. I've actually been able to attend that a couple of years ago. And they get to meet with other U.S. Aging board members who are also AAA directors and have other positions and go and meet with legislators and their staff. So often it is with the staff who can be more influential in terms of sharing the issues that we have and our needs. So really great experience for him and opportunity to continue to do advocacy on behalf of us and for our funding. So it's going to be a really good opportunity.
And that is Colorado only based, right?
U.S. Aging, the policy
that
briefing?
meeting that thing that he goes to, or is that?
No, that's the entire country.
Oh.
So U.S. Aging is the membership network for all of the AAAs across the nation.
Mhm.
So U.S. Aging actually puts on this event every year called Policy Briefing, and they arrange for meetings with staffers and with legislators. So great opportunity to go at the national level and advocate for more funding. The Legislative Caucus is state government, the one on March 11th.
Mhm.
So that one's in Denver. So that's the difference between the two.
They used to have different names,
Yes,
I think, for these. I'm trying to remember.
they
from
did. It used
my-
to be the U.S. Aging used to be the National Association
Or area
of
agency.
AAAs. Yes, it used to be N4A, and they updated that fairly recently, a couple of years ago. So yeah. So I want to end on a positive note and share that our ombudsman program recently completed their annual evaluation. They are an incredible program and an incredible group of people led by Lori McGinnis. And I'm pleased to announce that they received a category of exemplary. I have never seen that before for any program that I have ever been part of in my 10 years of in and out of AAA world. So I'm so proud of them and so pleased with the work that they do. They're often not in the building because they are out at facilities, which is where they should be. But I encourage you, if you're able to reach out to them or see them in the office, to express your gratitude to them. They really need that. Their work is, it's so very different and high level than the rest of the work that we do. And they often can't talk about it because of confidentiality reasons, but they can speak to the needs of the older adults and residents in our nursing homes and assisted living facilities. They're amazing people, just really wonderful human beings. And Lori McGinnis in particular, we were in a state where our data was a mess several years ago. The state had real concerns about that, and she has turned that completely around. Just has done an incredible job with that and really led her team with data integrity and response times, in resolution of cases, just a number of ways, and has really built up our relationship with the state long-term care ombudsman program. And we've gotten incredible support from the state for her. And they're really, really pleased with what she has done and what her team has done. So just wanted to get that on the record and hope that you all are able to pass along your kudos as well.
And I recognize that that's a little bit different from what this committee does, because we're dealing with things in people's homes or out in the community. But I'm wondering, Melissa, if we could have a presentation maybe by them
That's a great idea.
on that program, which
That's a wonderful idea.
would be helpful for people to learn more about.
Yes. Yeah, and that program is included as part of our budget discussions because that does come out of our AAA funding.
Mhm.
There is a federal pot that's earmarked for that, but it's not enough. And so we often supplement that with other parts of our funding. So the TRS discusses that. The RAC does get to approve that. So you will see the ombudsman program as a line in our budget when it comes time for that.
Great, thank
Yeah.
you.
And that's all that I have, unless anyone has any questions for me. Thank you all.
And so we'll do the last thing here, which is the RAC chair report. And I just want to really give a shout out to all the staff with what they've been dealing with in terms of just all the issues around funding. I know that you're all still waiting to find out even if the Older Americans Act is going to be updated and passed. I know that from what I remember, people were hoping that that was going to be done before January 20th through our federal legislation, and that didn't happen. So I don't know where that is, or if that's something that is upcoming or will be dealt with. But I know that all of our federal funding comes from that Older Americans Act, and we really need it. We really need it renewed. So I don't know if Melody, if you have any.
I don't right now. I'm hoping that at our next meeting, Jody perhaps will have updates based on the meetings that he's been part of and what he's hearing at the state and federal level. I hope that he'll have an update.
So we can all just hope that we're gonna be able to get that renewed. And that's basically all I have. Just a shout out to all our members and all the staff at the area agency here, and continuing. And I know that 25% not having that extra money it can be really problematic. I mean, we never have enough money to begin with, but at least we're not losing everything for next year at this point, which I think might have been a possibility. So I'm glad to hear that the staff is really working hard on that. And that's pretty much all I have for my report. I don't think we have, if we go to number 7 on our agenda, I don't think we have any discussion items. I do want to mention that at the last RAC meeting, we did set up, we did have a discussion about some travel for meetings. And I know that at this point, we're hoping to have our RAC meeting in Teller County in June and in Park County in July. And I think we set up, and it wasn't on my thing here, but I think we're doing something in Monument and in Fountain this year. And maybe we can just
So Fountain is probably a no-go,
Okay.
because the Fountain Valley Senior Center on Thursday, all of their rooms are booked. So we really can't have a meeting at the Fountain Valley Senior Center on a Thursday. So
Okay.
most likely no. And I will have to reconnect with Laura and Jared again because there was a connection to meet up in Monument. But then I ended up getting sick. So I'll have to reconnect with all those folks to figure out what we're doing up in Monument. So stay tuned.
So both of those are on hold at this point.
Definitely the Fountain is not going to happen at all.
Okay.
But Monument, we almost had closure with that, but we don't have it
So we
yet.
may know by our next.
Yeah,
Next.
for
meeting
sure,
if-
for sure.
If we're gonna have anything up and found.
Yep.
Great. Okay. And if we move to number 8, which is our meeting schedule, just to note, our next RAC meeting is March 27th at 10 a.m. And our RAC Executive Committee, and this is good information for those folks that are interested in possibly becoming on our board, but we have an executive committee, which is all the chairs of the various subcommittees, membership, strategic review, and TRS. And we usually do that through Zoom. And that's usually the first Wednesday of each month at 11. And it usually only lasts about an hour for those of you who are interested. And then the PPACG, which is our Pikes Peak board, and their meeting is, I think, what is it, the second Wednesday of the month. And that's also a Zoom meeting. I mean, you can participate, but you can go by Zoom. And I would recommend to anybody who is on the RAC, just maybe for once, sit in, or you can also review all their minutes and all the stuff that they're dealing with. I think the last one was like 500 pages because it had it had the transportation plan in there. And so you can go through all of the things that that they're looking at as well. Any questions about any of the meetings or? Great. And so I am going to adjourn this meeting. Thank you all for attending.
Thank you for allowing us to attend. It was really informative.